next few slides are just to give you a preview of what it would be like to participate in the online course that I'm offering for pathology review in preparation for Step 1 in COMLEX 1. How does poor cardiac output lead to more edema? There are two ways that this can occur. The two ways are that I get a backup into the right heart and the veins, which we've already talked about, and I get increased venous hydrostatic pressure leading to edema. Or I could have poor forward flow through the heart, and therefore I would have poor renal perfusion. When the kidneys don't see enough blood, they're going to activate the renin-angiotensin-aldosterone system, which will cause me to preserve water and sodium. When I preserve the water and sodium, I increase the volume of the vasculature, and that will increase hydrostatic pressure and therefore cause more edema. What is the most common cause of right-sided heart failure? It is left-sided heart failure. You need to look for pulmonary symptoms. Students get caught up in the right-sided symptoms, the things like jugular venous distension or hepatosplenomegaly or peripheral edema, and they totally miss the left-sided heart failure symptoms of shortness of breath or evidence of pulmonary edema. Left-sided heart failure causes right-sided heart failure because the left-sided heart failure backs up into the lungs, it increases the volume within the pulmonary vasculature, and now the right ventricle has to pump against that volume. It is trying to push all the blood in the ventricle into the pulmonary system, which is already overloaded, and that can lead to right-sided heart failure. What are the two most common causes of edema caused by lymphatic obstruction? When we talk about lymphatic obstruction, we should be thinking of breast cancer and filariasis. If I have single leg massive edema, you should be thinking filariasis. Now, we're not talking about edema from a DVT. We're going to be talking about DVT symptoms. We're going to be talking about edema of a leg due to a deep vein thrombosis. When we talk about filariasis, that edema is massive, where we get elephantiasis. We get big folds of the skin on the legs because there's so much edema present. How does breast cancer cause lymphedema? This is a question a lot of students get wrong because they think that the lymphedema is caused by the breast cancer invading into the lymph nodes and that's causing the blockage. That is not what causes the blockage of lymphedema. It's focal edema of the arm because we have removed the lymph nodes. And that's why we never put an IV on the same side as a breast cancer surgery, because if the lymph nodes have been removed, the drainage of that arm can be very poor and could put them at an increased risk for infection. Is lymphedema an exudate or a transudate? It is an exudate. It has lipid-rich and protein-rich fluid, and I have seen that question come up in several Q banks. What other malignancy are breast cancer patients at risk for? They're also at risk for angiosarcoma. And then the question is, why are breast cancer patients at risk for this malignancy? They are at risk because both lymphedema and radiation are both risk factors for angiosarcoma, and obviously many breast cancer patients have had radiation and have also had lymph node removal, which could lead to lymphedema, and therefore they could have two very important risk factors for the development of angiosarcoma.